I'd like to introduce Dr. Greg Nigh, owner of the Nature Cures Clinic in Portland, Oregon, US. Thank you for joining me, Greg.
Yes, thanks for having me.
Could you tell us when you first heard about LDN?
Yeah, let's see. I think I heard about it. It's been several years ago now. I would say probably 6, 7 years ago, 8 years ago, something like that. Because at the time, as a naturopathic doc, of course, we treat lots of people with lots of chronic conditions, and many of those people have one or more autoimmune processes happening in their body. And we, of course, certainly treat lots of bowel issues, for one thing, Crohn's and irritable bowel and those sort of things that often have an autoimmune component to them. And so, you know, I'm kind of a geeky, and I tend to just get into lots of research about things that interest me. And I have an interest in autoimmune diseases. And in that context, I think, is when I first became aware of LDN and the use of naltrexone in those kind of diseases. And then there's a book that I had read on it shortly after I kind of got into the research on it, was intrigued, found the book on it, and I don't remember the name of the title of the book, but it just compiled all the information to that point. This has been probably 5, 6 years ago since I read that book, but that was that's how I initially got introduced to it.
Mm-hmm. You were saying that you prescribe it for diseases that have an autoimmune component, and you mentioned Crohn's there. What other conditions have your patients tried LDN for?
Let's see. I utilize LDN whenever I feel like someone could benefit by having their immune system balanced. So there are sometimes, so in autoimmune conditions, it's not necessarily that it's just overactivity or underactivity. There's just an imbalance in the way that the immune system is self-regulating. And so LDN has, its lovely effect, of course, is to increase the production of endorphins. And in doing so, all the tissues of the body that have endorphin receptors benefit by that kind of surge of endorphins that come into the system as in response to that low-dose naltrexone given at night. And so when you look at the tissues of the body that are most heavily loaded with endorphin receptors, the immune system is it's very heavily loaded with those receptors. And so endorphins play a nice modulating role. So if things are overactive, it tends to calm them. If things are underactive, it tends to raise them, which is exactly the kind of effect that you want to see in autoimmune conditions. And so I have utilized it with everything from Crohn's and ulcerative colitis. I always would utilize it. Every patient I've had with MS and with I also utilize it with Hashimoto's, which is autoimmune thyroid, and in cancer. Essentially every cancer patient is taking low-dose naltrexone because there's a profound immune component to cancer, and in many ways, one of the fundamental aspects of cancer, some would say is the fundamental, and that is a breakdown in the ability of the immune system to recognize and get rid of cancer cells that are appearing. And so naltrexone, because of that nice impact on the immune system and raising up the things that are deficient, I think it's a very nice addition to a more, of course, a comprehensive protocol that addresses immune issues in other ways as well. But I think naltrexone is a nice addition, and it has this nice fringe benefit that it potentially, in many of my patients, I see it helps with their sleep, and it also people wake up with more endorphins, which is, So people, not uncommonly, just feel better. That's what endorphins are about. So there are just so many beneficial effects, and the window of safety is so wide when you're giving it in these low doses that I feel really comfortable utilizing it a lot with people.
Mm-hmm. And have any of your patients experienced any negative side effects?
Yes, there are. I would say, it is a very, very small percent, but I have seen it happen. And the two effects that I've seen, one, which is the less common, and that is that it interferes with sleep. So some people have had, either their dreams get really vivid and they can't, it's too much and they can't get good sleep, or they just aren't able to sleep well. And if that happens, then I simply change the scheduling on the dose, so that can be taken care of. The other, less common, but has certainly happened, and that is, and this has only happened in people that are very, very small frame people, so, really kind of skinny, even underweight, and that is that people get nausea, even at the low doses that we're giving. And so I will either have to taper back the dose to very low, or sometimes it's just not feasible to use at all. But sometimes I have had a few cases over the years where people had a pretty significant reaction, gastrointestinal, that they just felt nausea and stomach cramps and those things. And so in those cases, it's just idiosyncratic and it's somehow unique to those people, and it's just not a medication that I'm able to use then. But in the vast majority of people, there's nothing negative comes up.
Mm-hmm. And would you say that the people that do take it have a good response?
Well, yes. Of course, in the naturopathic world, things are done. Therapies are done in the context of a comprehensive treatment plan. And so I think it's much harder to judge individual effects of an item like naltrexone or like anything, because at any time, if the goal is to regulate imbalances in the body, part of that initial assessment and evaluation process is to really come to an understanding of which systems are out of balance here. And it's not at all uncommon that, if somebody has an autoimmune condition, well, certainly we know their immune system is out of balance, but once you get into kind of an inventory of symptoms, people have digestive imbalances, often musculoskeletal, often the nervous system is involved. You can look at labs and many times see things like cardiovascular and, inflammatory things happening in the cardiovascular system. So there's a whole range, endocrine, hormone systems get out of balance. So there are all these imbalances that are going on in one person. And so a treatment plan a good treatment plan addresses as many of those imbalances as possible in the most elegant way possible. In other words, you don't just throw individual things at every different imbalance, but you try to look at what are the commonalities here, so that you can really keep a treatment plan focused. So within that context, the immune system is almost always in some way dysregulated when people have some kind of chronic disease, whether it's chronic inflammatory disease, chronic autoimmune conditions going on, certainly with cancer. There's something is not right about the immune system, and therefore I think LDN is a very nice addition to that treatment plan. And and of course, we're also using intensive kind of nutrition therapy with people. We do a lot of different therapies in our clinic. We utilize IV therapy and acupuncture and Chinese medicine, and physiotherapy, and there are a lot of things that we're doing with people here, of which LDN is one component of that. So that's a very long answer to say that it's hard to tease out the role of LDN in bringing about the improvements that we see happen with patients. I feel like it is an important addition, and there have been a few cases where I could say one case was MS, and another case was in this patient had been kind of diagnosed at different times with ulcerative colitis, or maybe it's Crohn's, or maybe it's irritable bowel. They couldn't really pin it down. But in that particular case, it really was the LDN that got her off of all of her other medications, off of prednisone, and maintained her at essentially with no symptoms. And she's maintained that now for several years. It took a lot of additional therapies initially, but once we got her out of kind of a crisis state, then LDN has maintained her. And we know that it's LDN because she's, for a couple, various reasons, she has stopped it for a little bit of time, a few times over the years, and her symptoms pretty reliably come back. So that is one case that I would say it's clearly been the LDN that has done the work there. Mm-hmm. And then with the MS patient, that was another where we had essentially achieved stabilization. It had gone from a pretty rapid progression to stabilization, but we weren't seeing any improvement either in his fatigue level or muscle strength. And once LDN was introduced in that context, we did start to see improvement, slow, gradual. And that's a patient who, for various reasons, he moved out of town and no longer under my care. So I don't know the long-term follow-up, but I know that in the time that I was working, I do feel like the LDN turned the progression a bit. Mm-hmm. So those are, I think, the only two that I could really feel confident that I can point to and say that LDN is what made the difference here. And the others is just one element in kind of a synergistic treatment plan.
Mm-hmm. Thank you very much for sharing your experience with us.
Yes, absolutely.